Welcome everybody to the Global Alliance for Public Relations and Communication Management webinar for Health and Wellbeing Month. Welcome to everybody from around the world. We have more than 150 people that are going to join us online today from all different countries and time zones. So welcome if it is morning, lunch or evening for you. Today's Myth-Busting Resilience webinar is focused on how we learn how resilience is built through adaptability and workplace culture, not personal endurance. We are really proud to bring you this webinar to kickstart Health and Wellbeing Month. And we're very glad and very proud to be introducing you to Dr. Jaelea Skehan from Australia. But before I go into our introduction, we have some housekeeping for you. Today's webinar is being recorded. We would also like to just make note that some people participating in today's webinar may have a lived or living experience of mental ill health or mental illness. And we ask you to just take care the normal ways that you care for yourself. Now over to our introduction to Dr. Jaelea Skehan. Jaelea joins us after 20 plus years of working in the mental health sector, both clinically as well as a researcher, and more specifically as a global leader in mental health prevention and suicide prevention. She serves as the Director of Everymind, which is a globally leading institute in preventative mental health and suicide prevention. We'd like to welcome Jaelea to the screen and hand over to her for her to deliver her presentation. Thank you very much, Jaelea.
Thank you so much for that introduction, Jenny. I'm just going to share my screen so that we have some slides to help guide us through the presentation. I really appreciate everybody joining us today, and particularly I know that some people are online in the middle of the evening in the Americas, and so thank you to those who are coming at a less friendly time of the day, but I appreciate from wherever you are joining us and whatever time of the day it is. As is custom in Australia, where I'm joining you from, we will often acknowledge the traditional owners of the lands that we're meeting on. So to honour that, I'm letting you know that I'm joining you from Newcastle in Australia, which is the traditional lands of the Awabakal people, and I'd like to pay my respects to their elders past and present. And I'd also like to acknowledge any First Nations people and the traditional owners of any lands of which you're joining us from today. And also joining on from Jenny's point, I've worked in mental health and suicide prevention for about 25 years, and what has emerged a lot for us over those 25 years is much more involvement of people who've got our own personal or lived experience of mental health concerns or suicidal distress. And I really acknowledge anyone who's joining us today with that personal experience. And I also just want to acknowledge all of those people who share their story, tell story, and connect with others that help us understand how to do our work better. And of course, we know that absolutely includes people who are in the public relations and communication profession. Often many of us need to communicate about issues that also affect our own personal lives. And so I acknowledge those kind of dual roles that people often bring. I'm very mindful that I'm joining you from Australia, and some people have told me that the Australian accent is not the easiest English accent, so I will try very hard to be as clear as I can for those of you joining us today. And just, I think, to provide a little bit of context, my background is obviously in mental health. I've had the privilege of working with communicators and public relations professionals for more than 20 years as part of my work as one of the programs that we deliver but my background is in mental health as a psychologist. And so many of the concepts probably come from a more Western presentation of some of those concepts. So I've tried to keep them as general as I can, and I will acknowledge where I can along the way where there might be some differences in how people interpret that information. But I just wanted to share up front that I know that the sort of concepts we're talking about today will apply differently to individuals depending on your cultural context, where you work, the type of work you do, your family circumstances. And so I'm hopeful that'll be a useful starting point for many more conversations that you might have about these topics. So just to start the presentation, I wanted to just define a few key concepts in the ways that I mean them. And so these might not be the ways that resonate with everyone, but generally speaking, when we talk about mental health, we're talking about a positive concept. And so we're talking about something that we want more of and to build more of. And so it refers to our ability to manage different thoughts and feelings that might occur for us so that we can feel satisfaction and happiness, so that we can cope with and get through stress or sad times or difficult times, that we can set goals for ourselves and we can work towards achieving those goals, and so that we can make relationships with other people and we can keep those relationships that are important to us. And so really when we're thinking about our mental health, we're thinking about all of those sort of domains of health. So our spiritual health, our social connections and health, our physical health, which kind of come together in terms of our overall well-being and our overall mental health and well-being. It's not the same as mental illness, and it's not the same as mental health concerns, which I'll just define briefly. And so if I use the term mental health, I'm generally talking about that positive concept of building our capacity to cope, our capacity to make relationships, our capacity to do our work in the best way possible. It doesn't mean that we won't have challenges, but it means we have the capacity to manage those challenges. So I tend to use the term mental health concerns, but I know people will have a range of different terms. Jenny used the term mental ill health, which is one we use a lot in Australia. People might also talk about a diagnosable mental health concern, which we might call mental illness. But I tend to use the term mental health concern because many of our communities find very medical language like illness or ill health difficult to engage with. So, but there's a really broad umbrella of mental health concerns. And so I think the important thing to note is that absolutely anybody and everybody can experience a mental health concern, which is a challenge that you're experiencing where your thoughts and your feelings and your behaviours are not operating at their best capacity, that you're experiencing some challenges in how you're thinking and feeling. And so a common example of things that people talk about as mental health concerns might be stress or kind of challenges that people are experiencing. But we also know many people will experience what we in the health profession or medical profession might call mental illness, which is a diagnosable type of symptoms and experiences that continue for a period of time. So depression and anxiety are the two most common mental illnesses that people might experience across the globe. And we know that about 1 in 5 of us, so about 20% of people will experience a mental illness in any year. So those figures change slightly. We've all got our countries have got different ways of measuring mental illness, but the rates usually are somewhere between 15% and 25% of people in any one year in any country will experience a mental illness, whether they're getting support for that mental illness or not. And I think probably to think about for today is that all of our interactions and all of the places that we work, where we parent, where we interact as community members, can all have either a positive or a negative influence on our mental health and well-being. and can contribute to mental health concerns if we're not thinking about how to minimise that happening. So our work in particular, whether we work in really large organisations or teams, or if we work alone as practitioners that are working with different clients, the type of work we do, the way we structure our work, the things that happen to us at work, and the types of content that we are engaging with can either improve and help us kind of build up our mental health and wellbeing, or can put that mental health and wellbeing at risk. So I'm going to try and lean into some of those concepts as we go through. And just in terms of why it matters and why our mental health at work matters, I think what we know from good research is that generally work is very good for our mental health. So being unemployed, not having something meaningful to do with your days, not having the financial resources that work brings can be a risk. And so actually having good and safe work is very good for people. But poor working environments can also pose a risk to our mental health. And we know that mental health concerns are one of the reasons why people find it difficult to come to work or aren't as productive at work as they could be. And so globally, the World Health Organization has told us that about 12 billion working days are lost every year just to depression and anxiety as conditions. But there are great opportunities that workplaces can play, whether you're a workplace of one or a workplace of 100,000 people. Work can also have a positive impact on all of us. And so we'll try and talk through some of the ways that can occur. In some of the information leading up to this event, you will have seen some polling that's been done and some surveying of public relations and communication practitioners globally. And this looks like it's an important issue for people who work in public relations and communication. Often when we talk about mental health at work, and in many parts of the world where I talk about this topic, people often start thinking about health workers or perhaps our police or our defence personnel. So people who are engaging with perhaps difficult content from time to time. But actually this is important across all roles. And we know that because of the types of content and the very nature of working in public relations and communications, which we'll talk a little bit more about in a moment, it can have a real impact on people. So 91% of people, of you, were reporting experiencing poor mental health in the past year. 1/3 of people have said they've been diagnosed with a mental health condition or a mental illness, which is higher than the past time that question was asked. 29% rated job stress as very high, so up the top end of the stress level. 60% of people have had an experience of mental ill health at some point, and half the people, so 50%, feel workplace stress can really harm mental health. And we know that from lots of different environments, but it's important that we think that this is about us and about all of us and about every workplace, and not just about some types of professionals and some types of workplaces. So to get to the topic of resilience, so I'm going to talk a little bit about resilience and also talk about mental health and wellbeing, because they're related concepts, and resilience is often a part of mental health and wellbeing. But I'd like to talk about some things that resilience is and some things that resilience isn't. And so in some of the organisations that I have done work with, and so particularly if I talk to doctors, the term resilience is not one that they love very much, because often many of our understanding of resilience is about the person being harder and the person being able to do their work regardless of how difficult the situation and the circumstances are for them. But I think it's really important for us to go back to what resilience is and how it might be developed through our work, and also what it isn't. So resilience is really a process rather than an end state. People often talk about resilient people, But actually resilience is a process of adapting to challenges or really difficult stresses or unexpected adversity that occurs. And so over time, we build resilience when we are supported to manage those challenging situations well. People sometimes talk about it as bouncing back or rebounding from adversity. So being able to get back to functioning well or being able to not stay in the adversity for too long. And so this ability to rebound from challenges, the capacity to become strong and healthy despite a negative experience. And so people being able to continue on with their work and with their life and with the things that are important to them. And this learning process about how you learn to cope in the future by what you learnt from coping with a current challenge. And I think the important thing is that we talk about adversity, but they can be small challenges. So any change, any period of stress can be an adversity. So can be a moment that might be requiring resilience. What resilience is not, though, is avoiding difficult or stressful situations. And so just avoiding or not acknowledging a stressful or difficult situation is not resilience. It doesn't build capacity to cope. It is certainly not pushing through, working harder, working longer for long periods of time. That is not resilience, although I note that for some people, identifying as a hard worker can be an important value to hold, but pushing through difficulty and adversity without support is not resilience. Being overly positive is also not resilience. Sometimes people try to minimize difficult times or minimize adversity by being very, very positive. Like, it doesn't matter. I've got a growth mindset. I'm a happy person. So being overly positive is not resilience. And ignoring your feelings and your concerns is also not the process of resilience either. And it's also not just about what the individual does. And so it's this bit that I'm going to focus a bit more about as we go through the presentation, because I think one of the myths about resilience is it's just something that we're born with. We either have or we don't have. And it's just something that's all up to the individual to develop their resilience, and nothing about the environment we're in and what happens to us. And so I think it's important to differentiate those things. And so hopefully that'll be a key message out of this session today. And so we need resilience in lots of different circumstances. As we work, regardless of what that work is or what that role is, there will be lots of change. There is change in our family environments and in our communities, and there are things that happen in society that we won't necessarily be expecting. And so we need resilience when things don't go as we expect, because we need to be able to manage that change or that disappointment or that issue as it emerges. For any change, even positive ones. So one of the most stressful times of life that research tells us, or the two most stressful times, purchasing a house. So something that might seem as a positive can be a very stressful time, or moving places where you live, so moving house, and also having a child. So something that's mostly positive can also be a very big change. And so some resilience and building resilience is needed when we experience a loss of any kind, and also during difficult work situations. And I think probably one of the things, before we explore this a bit further, that's really interesting to me about public relations as a profession is often what our public relations professionals need to do is actually support organisations or support clients who are trying to manage something that hasn't gone as expected, that perhaps is an adversity. And so what you're trying to do is support communication and planning for something that was unexpected, but your job and your role has now changed as well. And so what you've got is this supporting organisations perhaps or clients to be more resilient, but also focusing on that for yourself. And so it can actually happen in two ways. Hopefully that's not too confusing. So one of the things I like to explore a little bit, hopefully this scenario will help with the concept. So both resilience, but also when we more broadly talk about mental health and well-being. So, but if we think about resilience, and this, some people talk about it as bouncing back or the ability to kind of move on to the next thing or to cope. I'd like people to think I've got a basketball and a brick on the screen for those who might be just listening, and just try and think about which of those two things are most likely to bounce back if we drop them from a height. It's not a trick question necessarily. So we know that the basketball is most likely to bounce back than a brick. And actually, if we drop a brick from a high height onto a concrete floor, it's likely to shatter or to break in some way. And so a basketball, you might say, is more resilient, if in that terminology, being able to bounce back. But it actually depends what surface they're bouncing off. So for those who might be just listening, I've got an image of a trampoline on the screen. And so actually, both a brick and a basketball have the capacity to bounce back, depending on whether they are dropped onto a surface that is hard or a surface that has some flexibility and some support in it. And so while the basketball will bounce back further, the brick will also bounce. And so when we think about resilience, and when we think a bit more broadly about mental health and well-being, actually it's the combination of what can we do for individuals? So how as individuals can we build skills? Can we build up, add in things that are good for us? And how as managers can we support people to build skills that are helpful for them? But how do we also create supportive environments so that actually it doesn't matter what's going on for the individual, people can actually be more resilient because we have much more supportive environments for people. And so if you're joining today as a manager of other people or a supervisor of other people or the owner of a company, I would say that thinking about mental health and well-being and what you as an organisation and what you can do as a manager or a leader of people can do for others is probably more important than what people can just do for themselves. But actually, it's the combination of those two things that really matter when we're thinking about resilience at work and if we're thinking about our mental health at work. And I'll come back to this quite a lot because I think one of the myths, and noting that many places around the world are at very different places with this approach, but we have tended to think about mental health as something which is about the individual, and we tend to think about resilience as something which is about the individual, but all of us work and operate in a broader context, which is our workplace and our environment and our networks, and we know all of those things influence how we show up and how well we are. So in countries like Australia and some others, not just Australia, there is now actually some legislation or some practice codes around what every workplace needs to do to be a bit more like the trampoline. And so what are the requirements of workplaces? But even if that's not legislated, even if that is not legally required, it's important for all of us to think about those things that show up in the type of work that we do. I'm going to work onto these a little bit quickly. So in the next two slides, what I think is really important for people to do is often we don't really think about our work and what poses risks at work. So what are kind of common workplace risk factors for mental health concerns? So thinking about if we're going to try and support people at work in their job, we need to understand the things that create more stress or concern or challenges for people. And then the second slide, I've talked a little bit more about what the research says about public relations and communication roles in particular, and then we'll round it back with some last tips for organisations and for individuals. So the things that we know from global research that contributes to poor mental health in the workplace and lower resilience in the workplace are common across lots of different roles. So the biggest one is things around what we call workload and job demands. And so it is, how much work do people have to do? What time do they have to do it? And is that reasonable? And you could already think about, I think, the public relations and communication role and how this might show up. The other thing is how much control and choice people have about how they do their work. And so their ways of working or how they do their work. Where there is inadequate support, and particularly supervisors and managers are really critical to people's experience in the workplace. So if you are a manager or a supervisor, it's important, and there are things you can do to build the skills of your managers and supervisors to understand how to best support people at work. Social isolation, so people feeling disconnected or on their own or not part of the group, can happen, particularly for people who work on their own. So even those who are in larger organisations, if you've only got one public relations or communication role, people can often feel quite isolated, even if they're surrounded by lots of other people. And so thinking about isolation in our work. Role clarity, so where people aren't clear about their job, they're not sure how to prioritise their work or the demands that are given to them. They are things that contribute to poor mental health. Anytime there is a change at work and that change is not managed well, impacts on people who are in the organisation. Lack of reward, so when people aren't acknowledged for their work or given recognition, not just through money, but also just through verbal and other recognition for their work. But also when there are traumatic events that people need to work on and the supports that they have are not effective. And I mentioned this earlier, but often when we think first about professional groups that are exposed to traumatic content, so things around, lots of things. So in my area, it might be communicating about mental illness, communicating about suicide, communicating about a natural disaster, a fire or a flood, a war, other events that are quite traumatic. Some roles have more access to information about those. And many people in governments and others often forget that our communicators often also have exposure to that content. People who are in digital roles often have exposure to images and words and experiences that other people in the workplace don't get exposed to. And so I've been an advocate for thinking about people who are in public relations and communications roles as being one of the professions that are on the front line when traumatic things need to be communicated about or people are exposed to it. And I think, I'd love to see more work done to acknowledge that across different countries, because I don't think we've been very good at doing that to date. And I think it then has an impact on how much an individual who works as a public relations professional can put their hand up and say, that's had a negative impact on me, because if we don't acknowledge that that can happen, then support is harder to provide. Some of the things that the research evidence says is particularly important for people in public relations and communication roles. Some of them are common to the others, but high pressure work and often crisis-driven work. And so whenever you're trying to work in a reactive or crisis way, often the deadlines are very short, and so needing to do lots of work in a short time frame. Many people, not all, but many people who are in these communication and PR roles feel like they need to be available 24 hours a day, or at least available after hours, on weekends and others. And that adds to us not being able to switch off from work, but also not getting a rest from work. Often client demands mean there might be multiple priorities, and particularly if you're working as a consultant to a range of clients, you might have multiple things all coming together at one time. public relations and communication people can also be exposed to the public around if there is public upset, and so they can be much more likely to filter out or be exposed to emotional or verbal abuse from different parts of the publics. There are times when ethical tensions can come up. So in some parts of work, we think about a term called moral injury, but I think I can talk about it as ethical tensions. And so what am I putting out? Do I think that's the right thing? If that's truthful or not truthful, how aligned to evidence is it? And these things can create internal tensions for people. And so how do you bring your personal ethics with an organization's ethics can be an interesting thing. The competitive environment for these types of roles can place strain on people, and also that information overload. So often we rely on, and I, as a mental health profession, often rely on my communication people in my organisation to filter lots of information and to summarise it in a way that I understand. And so there's a lot of information that we require, and that just creates what I call a load. It means the kind of brain is constantly trying to do big things. And so all of those things come together. So some of those things that we do can also be valuable because we might get a lot of meaning from our job of being a hard worker, of helping to solve problems for our clients, of being able to condense complex information into simple things. That might give us a lot of meaning in our job that can be positive for our mental health and well-being. But doing all of these things without support or without breaks or without thinking about how much it's impacting can make it too much. So there can be both positives and negatives from these elements. I'll finish up in the next few minutes, Jenny, just for noting. So there are kind of three key ways that workplaces, and I say workplaces, if you're a workplace of one, you're also a workplace, but these align to the World Health Organization's work on mentally healthy workplaces, but many countries now, some don't, but many do have some guidance on what mentally healthy workplaces might look like. And most of them use three kind of pillars or three core areas, but some might have more than three. But most of them are around how do we prevent or protect people's mental health and well-being. So that's about all of those kind of work-related risks we just talked about. How do I identify them and try and either remove them from work or make sure that we reduce the impact of those on the work? And it's probably the most important thing that people do, which is how does our work impact people and what can we reasonably do to make sure the work doesn't overly impact our people without support. The promote elements is about how do we promote the positive aspects of work, so the meaning we get from work, the social connections we get from work, the financial resources we get from work, and how do we build those up so that work can contribute to positive mental health for people, and also how do we teach people, how do we use work as an opportunity to support people to learn how to build resilience and build mentally healthy skills for themselves inside and outside of work. And then the third pillar is really that we know that people in our workplaces will experience mental health concerns, and many people in our workplaces live with mental illness. That's a good thing, right? That's actually not a bad thing. That's actually a good thing, because that diversity of experience and knowledge is really important to workplaces. So we don't want people who experience mental health concerns not to be in our workplace, but we want to make sure that we can support them in their work and make sure that we ensure that they're going to be safe and supported in whatever work they're doing. But don't get the message that we don't want people with mental health concerns in our workplace, because I wouldn't have most of my work and my employees wouldn't work for me. So we know that they're vitally important to our workplaces. So just the last few tips from me. Sorry, I've gone over a little bit. But for workplaces and managers, I think some of the key messages would be think about how you design the work. and what sorts of factors you've thought about already in terms of the workplace. There are lots of kind of tools that can support people, or even just starting the conversation with your team. It's a good idea to think about training managers and supervisors in knowing how they can support people, and also knowing about how work can impact on people. Encouraging social connection at work. We are social beings, and social connection helps us in hard times. Recognizing and rewarding good work, actually saying thank you for work, can go a long way sometimes. Providing good opportunities to learn skills and develop in your craft of being a public relations and communication professional. And make sure we don't discriminate against workers, and we do everything we can that's appropriate in your cultural context to try and start addressing the stigma that might be associated with mental health concerns and those who live with mental health concerns. For the individuals, though, I think it's important that all of us can think about what self-care at work looks like. And so, sorry, this has got an audio on it. I just didn't realise. I'm sorry, I'm going to skip through to that. I didn't realise, and I'll come back to it in a moment. But in the image before, can you hear that audio, Jenny? Can you just give me a thumbs up if you can? I've just realised that we've got a version that has an audio over it. So I'm just going to skip through, but I'm going to just mention those things if I can. My apologies for not checking with audio on before the presentation. But the thing I want to say is that often we think of resilience as just taking as much things as come at us, that we just do more work, work harder, work longer. But if you think about all of those things coming in as a bucket and as water going into a bucket, eventually that bucket is going to overflow. And so there are some things that we can do as individuals that can build our resilience and mean that we've got a buffer between the amount of water we can hold. And so we can make sure that we can build things in that build us up and protect us from mental health concerns. And so a couple of things that I think are particularly important is thinking about your work and life boundaries. And so some people talk about work-life balance. I prefer the term boundaries, because sometimes you mightn't have clear 50% and 50% balance. But when will you work and when won't you work? When will you take holidays and how will you manage those holidays and those breaks? Who else have you got to help manage your work if you've got too much work on and you can't manage it outside of work? And so really thinking about how you set some of those boundaries and how you make sure you have things outside of work. Think about your own physical health, so nutrition and activity and social connections can all matter, but building up your social connection at work can also really matter to people as well. And so I'd encourage you to think about all the different ways in which you might get support. And my apologies for going 5 minutes over, Jenny. Hopefully I won't be fired. But I'm happy to answer questions. My apologies, those slides didn't quite work, but I'm happy to share the slides, Jenny, if people wanted to just look at them as still images as well. So just let me know how I can be helpful.
Right. Thank you so much, Jaelea. And thank you for making your presentation and your information so easy to understand and very easy to pick up and use. I think that's definitely, I was getting some notes through from people that are in the audience, and they were some of the comments that were coming through. Just as I just wanted to give you a note is I forgot to introduce myself, which is horrible, in that I am a Global Alliance board member, Jenny Muir. I'm also the chair for the Health and Wellbeing Month for Global Alliance. So we're very pleased and proud to be able to bring this to you. I have collected a couple of questions just to kick off, Jaelea, and then we've got a couple that have already come through as well. But maybe if the first one, as you've kind of woven into your presentation, public relations and communications professionals and media, as well as you and I have worked across all three areas. There's this kind of a badge of honor or a toughness about that is sort of held within our profession, that we will be successful and we need to survive through all of the ups and downs of our jobs. Why do you think that is the case, or that's come to be as a kind of a either a legacy thing, or why does it still exist in our profession?
Look, I think lots of professions have these myths about who the professionals are and how we work. And actually, sometimes it's not just about debunking what resilience is, but it's actually also debunking what is a good and healthy and effective public relations practitioner. And I think we all have, there is no doubt that many of us in different organisations rely on public relations and communication people to do hard work, right? We do. You're advising, you're distilling, you're often the go-between with public or government or lots of different stakeholders. And so there's no doubt that public relations people work very hard, right? And can retain a lot of information and can work with lots of different stakeholders. And I would say retain the positive benefits and the value and meaning you get from the profession, but don't translate those values and ways of working to mean that means we're available 7 days a week, 24 hours a day, in order to prove that we're hard workers and we're good communicators and we can manage difficult situations. And so I think it's about reframing what actually are good values to hold on to, but what does that look like? And I think it's not sustainable for individuals or even for the profession, for people to be overworking, for people not to be supported, for people not to be getting breaks. And I think, you have those high periods, but how do you, I would encourage you and perhaps your global alliance to think about what actually is an effective practitioner, because it's those things, but it's not to the detriment of yourself, that without looking after yourself, you can't actually do your work. It's the reason why on a flight, they tell you to fit your own oxygen mask before you fit the oxygen mask of a child or another family member that might need support, is that if you don't take care of yourself, you can't take care of the people next to you. And if you think about yourself as a helpful and caring profession, then you must value first the care and support of yourself, or you can't do your job.
Yeah, totally agree. Now we've got a question that's come in from one of at audience. They've asked, what role can PR play in challenging the stigma surrounding mental health within our industry and promoting a culture of open dialogue and support for practitioners struggling with resilience? This is so up your alley, Jaelea.
Yeah. Look, there's a lot of things that there's lots of ways that public relations can help do this for our communities and our globe, as well as for the profession. And so the thing is, I often rely on our public relations or communication professionals to think differently. So I've got a mental health background, which means that I automatically think about these things through a health lens, even though I try not to. And so it's really important that we think about what other lenses, or what other examples could we use to illustrate different points. And so, but what we do know from research mostly is the number one thing that reduces stigma is contact. So it is understanding and being around people who experience the thing that we're fearful of, because stigma is about fear and it's also about ignorance or not having the right information. So I would say in two things, public relations can help us with the not having the right information, and how do we package that for different communities based on where they are and how they might engage with this. But also as a profession, things that have been helpful in other professions is there opportunities for people who are public relations practitioners who have had experience of mental health concerns themselves to talk about that and also what helped? Because I think what we need to do is we need to find solutions and ways through. And I'm very mindful that not everyone is in organisations or in communities where that might feel entirely safe to do. So it might not be for everybody. But in the area that I work in mental health, the thing that has been most important for us in terms of increasing people's knowledge and decreasing stigma has been more people who've got that personal experience being the front of our comms, not the back of our comms. So I think often one interesting piece of work we did in Australia, but I think resonates, is that if we think about stories that we pitch to the media or stories that we put out, often the traditional experts, so the psychologist or the psychiatrist or people like me who lead an organisation, are the most prominent spokesperson. And then you might have somebody who has a lived experience or a personal experience also providing a quote or providing some story. But actually what we found is more effective is if actually the personal story leads and the expert opinion backs that up. And so think about how you can bring together lived experience, data, and others to create change within the profession, but also within the communities and organisations that you're working in.
Jaelea, we've got a few questions that are all, I'm going to summarize them together because they all are asking about cultural settings.
Yes.
Obviously, because people are coming from across the globe, but they're putting their finger on the challenge and barrier that culture can, and I think they're looking at country culture or identity culture versus workplace culture, but probably take it as a whole. But they're very much focused on the culture of the country or the community and the barrier that plays to actually being able to connect these messages and achieve change.
Yeah. And probably one of the things I left out because I was being more simple is also the work environment and the individual also live in a society, and societal norms or the country's norms, the cultural norms will also shape how this plays out for people. And so we can't forget that. I think there's
I just want to add a note in for you, just to add, sorry.
Yep.
There's also someone's sort of added in, obviously the cultural stigmas around depression as madness and mental illness should not be in a workplace, things like that. Obviously, they're using those as examples.
Yeah, no problem. Well, I'll start there and I'll go back to the other ones as well. I think that's what I said before. I don't think everybody who's on this call in your global network would feel like they're in the position to speak up about their mental health concerns because it might not feel safe, or they might not feel they would be supported in the workplace. So we certainly need to do more work to ensure that people are safe if they tell those stories, and that they are supported and not exited from the workplace. And while we've seen a lot of change in many industries in Australia, there are still some instances where that would be the case. And so we need to be really mindful. We need to be really mindful of that. And so, but I think there's an opportunity to be a voice for change in a way that is supportive and makes sense. And I think the way in which you go on a very big journey, and this is often a very big journey, is by making a small step in the right direction. And so finding another leader or someone who's at least willing to start the conversation, perhaps linking into your global network for peers that you can talk about these issues, or countries or organisations that have been on a journey that look like it's less stigmatised and more help, and how did they start the journey, particularly where there is a bit of a cultural match. And so, often thinking about how can you tap into your global network to get some ideas and some support. But also there are lots of things that people can do that support people's mental health in the workplace, and you never need to use the word mental or health or depression or anxiety. And so I often talk about, you might start by thinking about what would be the outcome if we did this. So how could we make our teams work better together? How could we support people to do their best work? Now, people do their best work when they're not having risks or they're not stigmatized. And so you can actually start it by talking about some of the things you might do rather than the issue you're trying to address, because I'm very aware that for some people, talking about this as a mental health initiative would not be a good idea. But in some workplaces and in some countries that I work with, they've started to set up things like more peer-to-peer connection, okay? That also increases support, because not everybody can get health support or psychologist support, and it can be about work, right? So setting up peer-to-peer connection within the workplace will have a good outcome. And so thinking about where you can start, and I think thinking about the starting point's important. I also just I did see a question there about mindfulness practice. So mindfulness has got good evidence. So it would have been on my wheel of self-care things that you can do if I hadn't checked that there was a voiceover that wasn't mine also on the slide. So all of those things that people know are good for their well-being, good for their spiritual health, good for getting getting a break from work. But absolutely mindfulness is good. Exercise is good. Meeting up with other people is good. Doing things that are fun and enjoyable and give you meaning are good. And so all of those. And it doesn't have to be 2 weeks mindfulness retreat to have good practice, but 3 minutes a day. There's good evidence that 3 to 5 minutes a day can make a difference. Breathing techniques in stressful situations. So 2 deep breaths in together, like
the box breathing.
yeah, all of those things can make a real difference in the moment. So I'm about to go into a meeting I don't like. You can bet that I'm going to do a bit of mindful breathing just so that I'm more present when I turn up to do something hard.
Yeah. There's Jaelea, just to toot your horn, and because we've got a couple of the countries online that you've worked with and I've kind of supported along the ways, the Australian initiative with the Mindframe guidelines, and this is kind of coming at our profession from the other side, but it's actually quite empowering when you know that we can also play this role, is as professionals, we can be part of those step-by-step journey for changing cultural perspectives that help as the scaffolding around the journey that some communities and cultures need to go on.
Yeah, absolutely.
So for our audience, Everymind and Jaelea's been led this almost right from the beginning over the past 20 something years. Has developed resources that are guidelines for the media, guidelines for communication and public relations professionals, guidelines for stage and screen. There's a whole list of them, but they are guidelines on how to talk about, how to communicate, and how to represent visually all of these topics that we've been talking about today. And those guidelines have been translated into other countries in other cultural settings with quite a bit of work done by Jaelea's team. And I think Malaysia is one of the countries. What are the countries, Jaelea?
So Japan has recently translated our Mindframe guidelines for use in Japan. Malaysia have their own media guidelines that we have supported. New Zealand have their own guidelines. There are parts of Africa that have guidelines or are in development are in sort of development, and we have worked with India have guidelines for some parts of India. Many European countries do, but also I think what's important is to take what the evidence says, but also thinking about how it applies to those contexts. And Bhutan, we supported with some work as well. And so I think, I think we need to think about how where our country is, where our different countries are, and communities within those countries are within these issues, and how you communicate about them, because you certainly don't want to be talking about depression and anxiety, or even using the word mental, perhaps in countries where that's not appropriate. But the messages still apply, which is how can we get people to be more engaged? How can we make sure that when we communicate, people will be safe? How can we ensure that the personal experience is held up? And how can we encourage people to get support? And that support will look different in different countries and different contexts. It doesn't always have to be a health service. There's lots of things we can do for each other.
Yeah, I think so too. And I just wanted to alert everybody, or let everybody know, that on the Global Alliance website, we have got quite a list of links that are all free for you to go to find and use, of resources for mentally healthy workplaces, for resources, fact sheets and information. We've also got links across to resources in different languages, in different formats for you. So please have a perusal through all of those. You'll find, if you just go to the Global Alliance homepage, you'll find it from there under Health and Wellbeing Month. I also just wanted to let you know that Global Alliance's commitment to health and wellbeing is very much around, as we've discussed today, your individual mental health and well-being, as well as your workplace mental health and well-being. We are very committed to establishing a global measurement so that we can track that. As you saw in Jaelea's presentation, some of those data points and research points of the way that we are experiencing our workplaces and the impacts that that's having on us don't look good, and in fact are not good at all in comparison to other professions and industries, and also the general populations. As Jaelea mentioned, there are some unique aspects to the way that we carry out our work, and in some and many areas, the intensity of that work can have a detrimental impact. We're also mindful of the lag effect that people are all feeling around the world off the back of the pandemic, and that is having different expressions for different communities, depending on how intense that was for your community. And also for many communications people, you were often playing the role of having to respond and communicate. So you've got a personal, a workplace, and a community aspect to that lag effect for yourselves. So Global Alliance are really committed to understanding and measuring and reporting that on a regular basis, the way our profession is experiencing that, and very much supporting, obviously, the improvement of that data, so that people's mental health and well-being is improving. And as Jaelea has helped us understand in a really practical way, some of the very practical steps that we can take personally and in our workplace as a starting point. It is a journey. It in most workplaces, it won't be able to be achieved overnight or in a month or even in a year, because there's quite a lot of cultural components that need to be addressed. But the first step is always the one that you need to take. And I would encourage you to increase your knowledge and awareness personally, because that's always an empowering position to come from, and then to access the resources that we've been able to provide you and use them to help you champion a mentally healthy workplace within your workplaces. And if you need more support, there is lots of resources there, and within the WHO mental health section that you can access to go on that journey. And just a little plug for everybody who's still with us. There is a second webinar at the end of the month, which is actually being presented by the WHO mental health team from Geneva. And that will give you the context, the global community and personal context from a global perspective, and very much complement Jaelea's presentation today. And then we'll have some really great announcements at the end of the month as around the Global Alliance's commitment for the whole of 2025. Thank you, everybody. Thank you very much, Jaelea. As I've been getting further notes through, really practical and applicable information that resonates globally.
Thanks, everyone.
Thank you, and thank you, Matthias.
Thank you. Thank you for joining us today. Bye-bye.
Thank you.